Hello, everybody. Good afternoon. It's a beautiful afternoon outside. Hopefully, everybody will get to enjoy the slew of weather we have responsibly and safely. A lot of information today, so let's go over the information, then we'll take some questions. We've lost two people in the community in hospitals over the last 24 hours. Both of them were Caucasian women in their 70s. I want to think about them and their families at this time, and certainly we grieve with their families for our two neighbors. Currently, in this process, in this fight with COVID-19, we've lost 107 people to the virus. Related to testing, the testing has been expanded. We are now doing so much testing that we're going to focus in on infection rates by percentages because that's probably the most accurate way to look at this now. In the beginning part of this, we're doing symptomatic testing only. Then we were doing our obviously symptomatic testing plus some proactive testing. Now it's probably closer to over 80% of our testing's proactive, and symptomatic's closer to 20%. What we're finding is we're finding pockets of asymptomatic testing throughout the proactive testing. So we're going to try to get that data so we can share it. Asymptomatic individuals have had some exposure to COVID-19. We don't know enough about the asymptomatic cases, so they certainly get treated as if they're a full positive case. But so far we've done 27,376 tests. 25,812 tests have been returned. 709 returned since yesterday. We have a 3-day average of return tests of over 930. So let's keep that in mind. There are 1,710 positive cases since March 16th, 61 new cases since yesterday, and 24,102 negative results. Over our 3-day average of 932 tests a day, the positive rate of infection is about 6%. Since the start of this now, the rate is 6.6%. So remember, when we're doing symptomatic testing, it was in the 8s. Combine all of that overall, the data overall, it's at 6.6%, but over the last 3 days, the rate of infection is about 6% lower. But when you're doing almost 1,000 tests a day, 6% for every 1,000 tests is going to be 60 cases. So in the beginning, those were huge numbers, but now we're doing so many tests. From a percentage standpoint, it's actually the lowest we've been. So that will be interesting to watch moving forward. We have sent 1,483 tests since yesterday in Onondaga County, 1,483 tests. We have 1,564 pending tests. So again, 6% of 1,500, you're looking at probably 90 positives in there based off of the new trend. So we don't anticipate probably getting them all back tomorrow, but we'll get a huge chunk back. So as this process has moved forward, the way the information was being analyzed has changed as well. So now we're kind of pivoting related to not so much looking at new cases, but looking at the percentages because we're doing so many tests now. We will be doing universal testing at the Syracuse Community Health Center moving forward. So that's asymptomatic and symptomatic testing. Again, two targeted mobile testing sites this week, both on the city's north side. Thursday, May 21st, the Pastime Athletic Club, 9 to 5. That's on North Salina Street. And on Friday, May 22nd, Dr. Weeks Elementary School, Holly Ave, again, 9 to 5. If you want to pre-register and get an appointment, you can go to our health department's website and do that. But certainly we will test folks if they show up as well. So in the governor's briefing, There's conversations about him imploring local officials to test in minority communities, underserved communities. We're very proud in Onondaga County. We've been doing that since day one. No need to implore us. We've been doing it and leading. Looking at our regional testing data, 775 tests a day on average is our goal. Yesterday across Cayuga, Cortland, Madison, Onondaga, and Oswego County, we did 1,905 tests. So a massive testing day. We now are averaging about 1,400 tests a day on our 7-day average from May 13th through the 19th. So again, almost doubling the mandate. And what it allows you to do is it allows you to really do some things strategically. If you believe that there might be pockets of asymptomatic testing in some of the buildings in the community, we've kind of found that a little bit with today's results and yesterday's results. And so that's good. We wanted to find it. We don't know enough about asymptomatic carriers, so we want to get those folks identified and get them in quarantine. But in addition to that, certainly you can go into areas that you haven't seen a lot of testing done, and that's what we'll continue to do. Next week, we'll be in Lafayette, I think on Wednesday, the town of Lafayette for some of our southern towns. I think we're looking at Lafayette High School. We'll give more details on that. I know Chairman Knapp will be very happy with us with that. And we're going to go next look for some of the northern suburbs as we have a large population center out in our northern towns as well. So that's good. Looking at hospitalizations, I know there's been a lot of reporting on this today. I know I was venting a little bit on this yesterday. I will continue to vent today. Hospitalizations in Onondaga County now at 78 individuals. This is up 8 from yesterday. We have been saying the new executive order by the governor related to having individuals from the hospital go back to their homes in nursing homes is skewing this data. And we understand the fact that the rule says they need to test negative before they can go back to the nursing homes. The problem with that is we don't know how long that takes. If you're positive and you recover, the reason why you don't get tested to become a recovery is because you'll still test positive even though you've recovered. So the same holds true for this. So we have a scenario where our hospital numbers are going up because we have people that are in the hospital now that don't need to be in the hospital. So the question is, how many people? Today we contacted each hospital. We have 39 out of our 78. 39 people out of 78 are individuals that are essentially waiting to be transitioned back to their homes. So we've talked about this again with the state today, clearly skewing our data. This is night and day skewing our data. Again, the number, the hospitalization number as a metric does not have value if the data is being skewed like this. So we've asked that either these individuals don't count in the hospitalization number, or we have to figure out a transition to get these individuals out of the hospital. We've developed these COVID unit floors in many of these facilities. We think that's a reasonable solution to this process. But when you have 39 people that can be discharged from the hospital today, but they aren't because of the executive order right now, we have to figure a way around that. These 39 people can't be counted in our hospitalization numbers, and nor should they be in the hospital at this point. They don't need that level of care. So certainly that's something we're working with the state on, and we'll continue to brief you. But again, out of 78, 39 could be released today, but we got to get through this process. 16 individuals are critical. This is down 3 from yesterday, represents 2% of our active cases. Again, I would ask that we think about these folks and really their families and say prayers. These are individuals that are in a fight, and we need them to win their fight. Looking at the hospitalization numbers, 45 Caucasian, 21 African Americans, 9 of another race, and 3 individuals who have declined to share their information with us. To date, we have 201 people who have been released from our hospitals, up 2 from yesterday. So when we look at our stats, 1,710 positive cases, up 61. Presently monitoring 732 active cases, and we now have 876 recoveries. That's up 24. Again, a good number of recoveries. 15 individuals in our positive cases are household contacts of previously confirmed cases. So again, this is a trend now. A large percentage of our new cases are folks that are within the home, a much larger trend than where it was before. 3 of our new cases are related to senior living facilities. We're happy with this number because these are individuals that have a higher likelihood of needing to be hospitalized. So that's good. The nursing home testing has started. So the employees at the nursing homes are now being tested twice a week. We're going to have to watch to see if we know that there's lots of positive residents in nursing homes now. Is there any spread with the employees? More and more, we'll be doing a lot of testing now, so we'll see that in the data moving forward. And so when you look at that, right now, 18 contacts or affiliations, 3 from the nursing homes. Actually, let's see here. It looks at that. We have a community spread number of over 30. So it looks like we have 33, although that math doesn't really add up. That equals up to 51. So 33 community spread is the number, though we know that. So that's an increase in community spread number. So when you look at it, we're in 5 days of our new 7-day average community spread. We were closer to the 11, which is our all-time low. This data skews that number. Now that's up closer to 20, which certainly is good numbers, but we'll see how this moves forward. We're in phase 1 restart. We always knew we would get new cases, and this number would go up. Is this start of a trend, or is this one-day moment in time? We don't know enough yet. But needless to say, our health department's still comfortable with the caseloads, so we don't see a real challenge here, but it's information that we're going to digest and analyze very closely moving forward. We now have 1,768 people in community isolation or quarantine. CDC guidelines have changed. This number's staying larger, longer, because now 10 days to be considered a recovery out of isolation if you're COVID positive, no matter what your age is. 14-day process for our seniors, and then at minimum 14 days for a quarantine. So certainly this is a number that's going to stay in this range longer than it once was, since the rules have changed mid-process. Looking at our positive cases, 1,005 female, 705 male, 62 are under 19, 273 in their 20s, 206 in their 30s, 211 in their 40s, 272 in their 50s, 229 in their 60s, 180 in their 70s, 175 in their 80s, and 102 in their 90s. 20% are under 30, 32% are under 40, 44% are under 50, 60% are under 60, and 40% are over 60. That number went down a little bit. That's good. City of Syracuse, 923 total cases, 400 recoveries. Clay, 132, 96 recoveries. Onondaga, 127, 34 recoveries. Gaddis, 90, 29 recoveries. Salina, 76, 48 recoveries. Manlius, 66, 54 recoveries. DeWitt, 63, 53 recoveries. Cicero, 59 cases, 33 recoveries. Camillus, 55, 37 recoveries. Lysander, 33, 26 recoveries. Pompey, 24, 22 recoveries. Van Buren, 22, 9 recoveries. Skaneateles, 15 cases, 15 recoveries. Marcellus, 7 cases, 4 recoveries. Lafayette, 5 cases, 3 recoveries. Atisco, 5 cases, 5 recoveries. The towns of Elbridge, Fabius, Spafford, and Tully, all 2 cases and 2 recoveries. Related to physical distancing, we need to be cognizant. Please, 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 when in public, look out for your own health and your neighbors. Appreciate your neighbors' concerns and anxiety when you're in places where there's a lot of people, whether it's the store, whether it's the market. Certainly, we want to lead by example. All of our county employees, most of them have been wearing masks. I've made it policy that everybody in our county buildings will be wearing a mask when they're in the building or within 6 feet of each other, in public spaces in our buildings or within 6 feet of each other. That's smart. Why is it smart? Because we have encouraged our employees to get tested as well, and we have at least one of our employees who is tested asymptomatic. So asymptomatic testing, people are healthy, wouldn't think you have it. They test positive, right? Mental health, this individual tested positive for it. We don't know enough about that, so what's the risk? So we know this is out there. Using a mask is smart for yourself to limit the risk for this. They're asymptomatic people in the community, and the medical community does not know how contagious those individuals are. Looking at restart, a couple things. Oneida Shores Beach, starting Saturday, is going to be open. Friday through Sundays, 11 a.m. to 6 p.m. Capacity is limited to 150 people. The beach is 45,000 square feet. Normal capacity would be 350 people. The deep water section of the beach will be closed. And the admission price is $7 per car, and then the patrons are wristbanded. Personnel will be monitoring the beach closely throughout the day to make sure that the proper physical distancing is being followed. And that is some details on Oneida Shores Beach. The Rosamond Gifford Zoo will be open on Saturday, May 23rd, at 10 a.m. Members of the public will certainly be able to go to the zoo again. It will be by reservations, will be made online, and that reservations can start this Friday at 9 a.m. via our park's website. Admission will be in 30-minute increments. We certainly will have accommodations for those that are unable to purchase online, but there will be no more than 500 tickets sold a day at the zoo. We will have staff at the indoor exhibits and closely monitoring for physical distancing. There will be no food service at this point. There will be directional arrows painted on the floor to keep the incoming and outgoing visitors distanced. Our guest flow will be one directional. All guests will be required to wear masks, and temperature checks will be conducted upon arrival. So if you come to the zoo, you'll get a temperature check, and if you have over a certain temperature, that guidance will be given by Dr. Gupta, you will not be allowed in the premise. Drinking fountains will be closed, but 2 water filling stations will be available, and the regular admission prices will be the standard. Related to our libraries will begin their phased-in opening on May 26th for the library takeout to get books, DVDs, and other materials. People will be able to make reservations like they always have via the website and by calling the library. We are asking that people make reservations for pickup so we can have your materials ready to go and get you on your way very quickly and efficiently. After you have placed your order, we will let you know when it is ready to be picked up. We then ask that you please contact the library. You will be getting your materials and schedule a half-hour time slot for pickup. When you get up to the door, please show your library staff, our library staff, your photo ID. They will then pull your materials, which will be in a new paper bag, and leave it on the table for you to take it and go. We ask that anyone participating in this wear a mask, practice physical distancing at all times, and be patient with us through this process, as this is new for all of us. Not every library in the county will be able to reopen at the same time. We can open up our Onondaga County libraries in the city of Syracuse, and there are also a few suburban libraries with the same ability. I believe the Baldwinsville Library is one that has been reported on. We are also still not collecting fines on any of the items that were checked out previously, and we are also not asking folks to rush and return those items. Anything that is returned, any of the materials to libraries, will go into a 7-day quarantine. So those are for items that are returned. Related to certainly restart, I think we now have over 470 businesses in Onondaga County that have filled out the proper Forward New York attestations. That's doubled essentially from earlier in the week. Questions related to business reopenings, ongoved.com. Click on the email form. You can email any questions. You can call us, email complaints about a business, and call us. The number 315-435-2210. Questions?
You mentioned all of those hours. Are those ongoing openings now? Now that, Oneida Shores opens up on Saturday, it will then be open the subsequent Friday through Sundays throughout the season?
Correct. And we'll give more, certainly, at some point, Jamesville Beach is going to be open as well. So we'll let people know when that's ready as well.
And the deep water being closed, is that just a staffing thing?
Yeah, it's staffing. Certainly you need more staffing if you're going to have swimming. I had some individuals reach out to me saying you should have opened Jamesville up. It's easier to swim and do laps. Unfortunately, at this point, this isn't about really the exercise element of swimming. It's about giving people the opportunity to get outdoors and spend a little bit of time and maybe wade in the water on a hot day. We understand the value and the exercise component to it. We need to get our lifeguards and everything staffed up and ready for that.
Are you asking people to wear masks at Oneida Shores?
If they're going to be within 6 feet of each other, yes.
And if people aren't wearing masks, will park rangers kind of be handling those situations?
Yeah, park rangers will certainly provide them with a mask so that they can wear one.
Today, the governor mentioned that starting tomorrow, religious gatherings can start up to 10 people, and yesterday you were mentioning that you would like to see a 25% capacity. Can you talk a little bit more to how the county will go about that now?
Yeah, well, we're going to follow the state guidance, but essentially people have been able to get together 10 already, so the governor has given clarity on what people have already been doing. We think there's value in a phased-in approach to this. And so certainly 25% capacity in phase 2 with religious gatherings, 25% of the building capacity, everybody at minimum 6 feet apart, makes sense to us. I ran that through with Dr. Gupta. She felt comfortable with it. So we're encouraging the state to look at that type of process. Whether the state will do it or not, we'll see.
Have they given you any feedback as to the 25% capacity?
There is apparently a subcommittee, an advisory council that's been created by the state. Some of our local pastors, Pastor Jaime, Reverend Turner, are on that. So certainly we'll share that information with them so they can advocate as well. But I've not gotten direct feedback saying your idea is a good one, but we're not going to do it, or your idea is a bad one, but we're not going to do it, anything like that. So 2 straight calls, I voiced my opinion on that, and something that's what this process is about, is doing things that make sense and that you can do it safely. And nobody's ever had to do this before in the last 100 years, and certainly not under these conditions. So when we see things and we learn things, even if it's not very clear, or part of it could be phase 4 for the most part, but maybe a piece of that business could operate sooner because you can do it safely. It's our job to advocate for that. And so that's what we're going to do as long as we can do it safely. And so there's some businesses that they're normal businesses that you get together and there's lots of people in a room. That probably can't happen right now. But some small parts of their business don't have lots of people in a room. Could we have that happen sooner? Those are the types of things that if we think it makes sense, we advocate for.
You mentioned Dr. Gupta a couple times today. Is there a reason she doesn't come to these anymore, or hasn't been coming as often?
She's very busy, and quite frankly, spending an hour of her day up here with me is probably not the most effective use of her time. So when there's something related to a health-driven process, Dr. Gupta wants to be here, or reiterate a point, she wants to be here. But right now, the whole everything that our health department doing is leading in the state. Contact tracing, this new program's up and running. Onondaga County is one of the leaders in doing that. Dr. Gupta is heading that up. So spending a time at a press briefing really isn't a good use of her time in the middle of this pandemic, unless it's necessary.
61 new cases is the most, I think, in a week. I checked, it was 63 on May 13th. Is there a story behind those numbers?
I mean, I think I could say the story is we have the lowest infection rate in a week today. So you're saying it's the worst in a week. I'm saying it's the best in a week.
I'm just saying it's 61.
So that's what's so interesting about this whole process. And when you learn about the virus, look, at the state of New York came up with a hospitalization criteria that made sense for a restart until it didn't make sense, because now there's a rule that's forcing people to have to use the hospital for a hotel. So that number isn't as valuable. Now we're at a point where in week 3 or 4, if I had 61 cases, I'd be pulling out my hair. But that's because we're only testing 200 a day. So your infection rate was so high. Now we have our 3-day average, lowest infection rate we've had yet. So it changes. But the one thing that there could be a story in the numbers, and we don't know enough yet, is the 33 community spread. Is that the new trend that we're seeing? We've been at 18, 15, 14, 11. We had a couple days where we were in single digits. And now we have restart. I think we're 5 days into it. Is this the new trend for community spread? I think there's value there, but I think the number 61 to me doesn't mean a lot, because we're doing essentially how many? I mean, we did 1,400 tests. 1,400 tests. You're not going to get 20 positives when you do that many tests, or else we really made significant progress with the virus.
You took my question critically. Maybe I was too vague.
No. But I think that's how you gotta. It's a good question about how the data. If you don't really talk about all points of the data can be used for narratives. And so my job is not to drive a narrative up here. It's to give the data, explain the way we're looking at the data, because that's how decisions are going to be made, is how we're looking at it. And at times in this process, the data has been scary. At times it's changed, and you're trying to assess it. Now I think we're at a point where we don't know enough about what the numbers today looked at, other than 60. I don't look at the 60 new cases as a problem. I'm more interested in the 33 community spread, saying we were averaging 14 or 15 a week pre-restart. Now we're going to average, what, in the early little 20s? And then phase 2, is that high 20s, 30s? That's more what I see out of this, not so much the 60 cases by itself, because we got back almost 1,000 tests.
And what I meant by story is when people weren't social distancing, you were calling them out saying we're seeing community spread from socializing. Then it was nursing homes. The upticks were all based in nursing homes. I guess my question then, more accurately, more specifically, is these 61 sick people, where are they coming from? So
I believe we don't know yet if it's a community-driven issue. And what we do know, and I've asked Dr. Gupta to try to compile the data, is that there's a lot of these folks in community spread are asymptomatic. So trying to understand that, I think there's value in looking at that. And how many of them were done are driven related to the senior buildings we just did, but we're in a community spread number right now, and they may get reassigned. So we don't know enough, but certainly last week we anticipated an increase in community spread cases with restart. And is this the first day where we finally saw that caseload up more? And is that going to be a new trend, or is it a moment in time? But I think on the overall number, we're going to start looking at percentages more the number of cases if we're going to do 800 to 1,500 cases a day in Onondaga County, because we were doing 200 a day for a period of time, and that's when you saw the lower number of cases. So it's really the infection rates are what we think are the most accurate way to look at it now.
Ryan, going off of nursing homes, are the majority of the new hospitalization seniors coming from these facilities?
They're seniors. I'm making assumptions that a lot of them are coming from these facilities, but knowing where the positives are, these are not, I think, at least yesterday, and I didn't look at the hospital numbers today from the age demographics, but I don't believe there was anyone in the hospitals under 50 years of age yesterday. I'll look at that more, but I think your question is right. Many of these are individuals who are seniors with pre-existing medical conditions. Just knowing that information, many of these individuals call nursing homes their home, their residence, and I think many of these people are going to the hospital because they're sick now. And so that's going to be a trend. That's the trend we've seen with in the beginning part of this process. Our senior living facilities were not impacted by COVID the first half of the process. They have been in the second half of the process, and now, unfortunately, that's why you see the mortality rates driving up, because these were the most vulnerable people to the virus as far as bad outcomes. But again, on the hospital numbers, 78, if I told you today that we were at, 40 minus 78, 38, 39 hospitalization numbers, we'd be doing high fives, because that's so much further down than where we've been. There's literally 39 people that could be discharged, but with the rules right now, this is where they have to stay, and that's skewing these numbers.
And a couple weeks back, you were mentioning that you thought a majority of these cases from senior living facilities that were coming to the hospital were people who didn't necessarily need to be sent. Do you think that's still the case, or are you seeing that it is people who actually need to go to the hospital?
Yeah, so that's been fixed. These COVID units were built up in the nursing homes. So the larger ones developed COVID floors. So if the smaller ones can't handle it, they then send that resident to the other facility, and that's where they will stay while they have COVID. And that's a solution to this issue, too. We've built up these COVID units within the facilities. Let's allow them to go back to COVID units where they're not potentially risking the non-COVID residents of those buildings.
Is the virus still spreading in nursing homes? I just want to stay on that point quickly, because after a certain amount of time of proactive testing and then some time for recovery, you'd think you'd be able to catch it, stop it. What are you seeing in nursing homes?
Yeah, the numbers have gotten better, because I think the influx of residents getting it, the people who have gotten it, better PPE, better management, COVID units being put in various buildings, so you're mitigating that risk to the rest of the non-COVID residents. And the numbers reflect that. Now, the numbers coming up now related to nursing homes and senior facilities, remember, all employees of assisted living and nursing homes from, is today Wednesday? Today moving forward, have to get tested twice a week. So again, why is that? It makes sense, because there's an assumption that many of these individuals were asymptomatic, coming to work, potentially spread the virus that way, and then it flies through the homes. So this will at least capture that and limit people from outside the properties coming into it. Terry, you had questions?
Yeah, sure. So can you talk a little bit more about the asymptomatic cases? Can we find out more about who they are? Are they young people? Are they in the workplace? Like, is there any, what can we learn from that?
I don't have enough information to talk about it is from a scientific standpoint, but we knew we found asymptomatic cases in assisted living facilities when we did all that proactive testing, and we found it specifically in buildings that we already had COVID cases. So we are now doing pretty wide, broad-based testing, and we're finding some of these folks are asymptomatic. These are people that are not sick, and some of them just want tested to get tested, and they found out that they've had some level of exposure to COVID. So,
Can we work toward getting that data in coming days?
yeah, we're trying to. We don't have it all compiled now. So it's not that we don't have it. And so I'm sure at some point I'll get a request for it from one of our outlets, and it's not ready yet.
I also wanted to ask about the regional council. What did you discuss today? Were there any decisions coming out of that?
No, so today we talked, each day we go over the data from the county, just like we do here. And we talked to the state about, we talked about this hospitalization issue. I know the governor got asked about Finger Lakes and Central. I think we got the same issue. And if we're having the same issue now, it means the state numbers are going to eventually be impacted too, because everybody's going to have the issue. And so we went over that and, you know, provided solutions. Either just don't count it in our numbers, but this is long-term. We can't have people just being housed at hospitals either. That's not sustainable. So we got to figure out a transition for these folks to get them either back home or some other facility. So we got to address this. This is an unintended consequence of the executive order. Then we went into some of the things we're seeing and some of the questions that we don't have good answers for the business community.
Such as?
I'll give you an example. The belief is that gyms are going to be allowed to open up in phase 4. So professional services, phase 2. So an argument's being made, and I agree with the argument. If you have a licensed physical trainer who's training a client one-on-one in a huge gym, 30,000 square foot, that can stay 6 feet apart, why can't you do that in phase 2? To me, that makes sense. So what happens is the community brings that to my attention, makes complete sense. We talk about it internally. All right, we advocate to the state of New York to look at this and maybe give clarification. And so those are the types of things that happen, not just in Onondaga County, but every county, is they're hearing and we're learning through this process.
How often do you speak to the leadership of the 3 colleges in Onondaga County? And, you know, we saw Ithaca release earlier this week that they're going to start their semester in October. Any idea on what the 3 colleges here are thinking in terms of a reopening on campus?
Yeah, I think they're vetting their plans with the state a little bit. The private colleges obviously they're private businesses. They can do their own plans. They would be phase 4. Certainly phase 4 should be well before, college campuses start up again in the fall. But they got to make decisions now, because nobody's going to enroll if they're not going to be sending their kid to college. And the online college experience probably isn't worth as much money as the physical college experience. So I think Lemoyne and SU in our community will have their plans out sooner than later.
Of these people in the hospitals that are nursing home residents, are they people who you say shouldn't have gone in the first place and that were in that wave of COVID positive patients who just got dropped off there? Or now they've since recovered and you say they should go back?
Correct. Second part of your question. So these are individuals that were sick in the hospital, are now better, and do not need to be hospitalized anymore. And the only reason they can't go back is because they have to test negative for COVID-19. Remember, the intent of the executive order was a good one, and the nursing homes asked for it, but they weren't referring to COVID positive recoveries. They're referring to if you are having a surgery and you're going to go get rehab at a nursing home, that before you go, you get tested for COVID. Now, that rule now is being interpreted by the hospitals that I can't let this person out of the hospital until they test negative for COVID. Well, if you are positive for COVID, that could be a year from now. We have no clue when that's going to be able to take place.
So you're saying that this is based on the hospitals and not the nursing homes rejecting
Correct.
patients?
The guidance that their interpretation of the new executive order by the state related to if you are going into a nursing home, you have to test negative for COVID-19. And these are people that lived in nursing homes, have recovered from the hospital part of their process with COVID, but we know that they're not going to test negative. And we don't know how long that's going to happen. And there's 39 out of our 78 that are in that position.
Is there any concern about trying to discharge them from the hospital while they're still COVID positive and then going into a nursing home and bringing the virus there? Because
No.
that seems to be the concern.
That is the
that
concern.
executive order.
Yeah, that's the concern, but these are folks that are essentially recovered, or why wouldn't you send them into a COVID unit until you deem them recovered related to the CDC guidance? Or let's figure out another plan. But what you can't do is hold these numbers into our regular hospitalization numbers, because these people don't need to be hospitalized anymore. And so you can't allow this to skew our data anymore, especially related to any sort of restart process.
Are nursing home cases being counted as community spread?
Do what?
Are the nursing home cases being counted as
No.
community spread?
Nursing home cases are senior-related cases.
Should they be included as like a community spread case since they're all?
No, they're remember, these are folks that have not left their building. Nobody's allowed to visit them. So the quarantine they've been quarantined. So when you do an investigation, there's nobody really to investigate outside of the staff. The staff's now being tested twice a week. Scott, you had a question back? Good question on the gift shop. No gift shop is what I'm being told from the back of the room. Hand sanitizer, of course. Am I comfortable? Yes, or else it wouldn't be opening. And do we have enough staff? Absolutely. So those are the short order of the questions to the point.
With the zoo and the beaches and everything opening, does that mean you're bringing back some of those furloughed or laid off 104 line employees?
No. Well, lifeguards, essentially, parks, yes, some of them. But for the most part, our line of part-time workers are still, their hours have still been cut to zero.
When you set out to handle this pandemic, and you know you had to rely on your health department, did you ever think you'd need other departments to redesign how they operate from the bottom up to allow for social distancing on beaches, limits on how many people can be inside the zoo, library curbside service? I mean, this is touching every service you offer.
You're 100% right, and that's why it's such a challenge on restart, and why the governments are, and this is part of why I don't Monday morning quarterback my colleagues in this process, is because everything we're doing changes when rules change, and nothing was prepared for this. The infrastructure of decades or 100-long infrastructure wasn't prepared for this. Our civic center is not prepared for physical distancing. It's not. It wasn't built that way. You have different services on different floors. So when you have 14, 16 floors on a building and different floors, where do people go? They don't all use the stairs. They all go to the elevators and stand right there, petri dish for this virus. So we can't, even if I wanted to bring back everybody to the building, I can't because I can't keep everybody 6 feet apart. And so libraries, same challenges, right? All this is a challenge. So how you restart this after shutting it down and learn how to live with the virus is very complicated. And it's not easy on the federal government, state government, or your local government, and the private sector, and residents at large. So that's the challenge of this virus, outside of that it can make you very sick.
Ryan, oh, sorry. On Memorial Day, the governor said that there could be car parades and very small ceremonies. But what should we expect on Monday? Are villages going to have parades, and what are you hearing?
Yeah, I don't think so. I think that most of them have been canceled. Unfortunately, this is the reality. Some of the guidance came out a little bit late, but there's no way you can, on a Memorial Day, think about the position you're putting yourself in. If you're going to have a ceremony to 10 people, and all of a sudden 20 people show up to remember our fallen heroes, you're going to what? You're going to break it up. I mean, so it's an impossible situation to be in. So common sense says that you just have to cancel it. And the community should remember in its own way. And to the point about the flags yesterday, Memorial Day, our staff will be putting out all the flags again this year as we did last year at the Veterans Cemetery and honoring it. And so that's the car parades are something we got a request about a motorcycle parade honoring the our fallen heroes. And so, yeah, of course, please do it. But overall, your traditional Memorial Day ceremonies that we have and that mean so much to us just aren't going to be able to happen this year.
Do you have a date on the flags?
I think this week they're going up.
People,
so
we're hearing from people who are eager to see
yeah,
those.
they will be up. My staff in my office are doing it themselves.
People on your Facebook feed don't like when I ask your opinion for things, but I'm going to about the Turning Stone. Obviously, the casinos are not in Onondaga County. The Oneida Indian Nation is a sovereign nation, but a lot of people from Onondaga County travel to Oneida County for it. Your concerns or thoughts?
Yeah, I reviewed the plan that they put forward. Quite frankly, one of the best plans I've seen. The level of detail, and certainly the Oneida Nation, a sovereign territory, sovereign country, has demonstrated the ability to run a class business out there for a long period of time. So I'm comfortable with it. I mean, they're essentially doing it in phase 3, and even, phase 3. So they don't have to wait till phase 3. They're doing that really out of respect for the process. And as our county and Oneida and Madison learns more. And in addition to that, they're opening up regionally, essentially not allowing patrons to come from other parts of the country that have experienced hotspots. So I'm supportive of it, and I think I know County Executive Pacenti is supportive of it. Chairman Becker is supportive of it. And so I think this is part of the process. At some point, Destiny USA is going to be open again.
Did you see the plan before it was released publicly? I know Anthony
I did.
Pacenti did. You did?
I did.
So you were given a courtesy call or
Correct.
update?
Correct.
When are we going to get to see the next round of sales tax numbers? And do you have any indication so far that cars are starting to sell?
I ask, I've gotten to know these car dealers really well, so I text them every often, ask them about businesses. I think business is okay in May. They might be able to salvage May year over year. Year over year with April was not good. So we expect, I think we have a payment coming in either late next week or early the following week, which will be reflective of the shutdown as well. So we expect that this next payment will be a tough one. And then maybe at that point we'll have to look at the calendar of payments and when you get the payment for what period of time it reflects. But hopefully at that point we've bottomed out, and then it's whether we stay bottomed out or we start to crawl back a little bit.
You mentioned that a county employee tested positive asymptomatically, and I know you can't disclose exactly who that is, but is it someone that you've come in touch with, and have you been tested?
Nope, I haven't been in touch with this employee. No, I have not been tested. If I had you would have got me on this one, though, Trish. That was a good. If an asymptomatic positive was in touch with me, I would have to go get tested and stare down the test, the swab. I saw the governor with the swab. He handled it pretty well. I question if they went far enough up the nostril for the swab, but the governor took it like a champ. I'm mortified of that process, but I know you will celebrate the day when I have to go get tested.
It looks like it went pretty far up his nose if you watch.
Did it? I didn't look at it that much, but it was certainly he handled it very well.
I have a question from our sports department. They're wondering if you've been in touch with anyone at OCC or the TBT, the basketball tournament group, about their plans for July.
I really want it to happen. I think it's one of the coolest things going is that tournament and all of our Syracuse alums playing. I think what the state guidance has said to professional teams is you can play, fans maybe too soon, but I think if we're in a certain phase 4, they're good, right? Phase 3, this is kind of it comes down to common sense. And is there a way, if we're in phase 3, which would mean that we've had hiccups along the way, that you can still have some capacity. And I think the way we've looked at it is you have small capacity phase 2, you test it a little bit more phase 3, and then phase 4 you open it up. So that is an awesome tournament. So I'm hopeful we can have that tournament.
At what point is spread a concern for moving to the next phase? I'm not sure that's written in a metric.
Yeah, really, the spread, it's not just the numbers, but it's who's getting the virus. Because this is all about, the reason why we flatten the curve was because you needed the hospitals able to treat the sick, so that limits death. And so that's why we did what we did, so that you flatten the curve to save life. That was accomplished. So really the spread, it's more who is getting sick. First half of this, it was spread, to your point. Everybody, remember 20-year-olds were the number one category. I think the 50-year-olds are about to take the 20-year-olds now. But then second half, our 80 and 90-year-old neighbors who had not gotten a lot of cases in the first half have spiked up. And now we've seen our mortality rate spike up directly with that. That is the cruel reality, but it makes sense. So it's who's getting it in the community spread that will drive hospital numbers. The hospital numbers are what is the metric of your medical infrastructure's ability to fight the virus to avoid death. So if there's 30 cases and it's hitting demographics that respond well to the virus, you probably won't see your hospital numbers move up. But if those 30 community spread cases are demographics don't respond well, it's going to impact your hospital numbers.
Hey Ryan, could Dr. Gupta be made available for questions that we could have?
You can work with our press team about questions from the health department, and they can work on that. Again, Dr. Gupta, she's leading the fight against this virus, and her department answers all questions, but her time is very valuable, and so if you have specific questions for the health department, you can get them off to their media team, and we'll try to work the best we can with you. Other questions? Again, big shout out for its Emergency Medical Services Week. We've never utilized our emergency medical teams more than we have right now in this process. Whether setting up testing sites, coordinating testing in nursing homes, adult and living facilities, ensuring that we have ample medical transportation, partnering with labs to do more testing that we've been doing. This is all done with our emergency medical team, and so I want to thank them in our county and throughout the state. They do all the work that helps us get the information for our health department to do their job. So this process has been a team effort, so I want to thank them and thank the community again. We have big challenges ahead of us. We need to continue to do things that keep ourselves and our families safe. So enjoy the weather, but please do it in a safe way.